My name is Jonathan Castro. I'm over the age of 18, and I consent to being recorded.
This is Ryan Wojciechowski. Here's my note card. Alright, so we're going to knock on the door. My name's Ryan. I'll be your nurse for today. We're going to be doing a physical exam for you. It may take around 20 minutes and involve some touching. Is that okay with you?
Yes.
So then next we're going to identify our patient with our two patient identifiers, so ask for their name and date of birth.
Jonathan Castro, 3/15/1996.
And then before we come in contact with the patient, we're going to do our hand hygiene. So he knows what his name is. Can you tell us where we are right now?
Las Vegas.
Can you tell us about what time it is?
It's around 4:50
And can you tell us why you're here?
for an exam.
So our patient is A&O times 4. His face is symmetric. And we're also going to test cranial nerve 5 by taking the cotton ball, touching the side of his face here. Close your eyes. Tell me when you feel it.
Yes. Yes. Yes.
Good. All right, so cranial nerve 5 is intact. His verbal and nonverbal expressions are congruent. He's able to follow commands. His speech is normal and content is appropriate. His hearing seems to be within normal limits, and his personal hygiene is good, and his dress seems to be normal for the weather. So now we're going to move on to vital signs. So we'll start with his blood pressure. And then, are you in any pain today?
No.
No? Hold on your arm here. This right here. Blood pressure was 122/80. Next, we're going to just have you stick out your finger here. Put this in your mouth for your temperature. Wait till it beeps. Write this down. Oxygen saturation is 98% on room air, and temperature is 98.8. And next, I'm going to take your pulse here. I'm going to be here for a full minute. So his pulse was 74 beats per minute. 74. And his respirations were at 16. So his skin color is consistent with his ethnicity and is warm and dry to the touch. We're going to test his skin turgor. So that's within normal limits. There's no lesions, tattoos, or scars noted. He seems to be well nourished, and he is a 23 out of 23 on the Braden scale. So next we'll move on to the head here. So we're going to palpate his head. His head's going to be normocephalic. His hair seems to be even, with no bald spots or anything. His face is symmetric, so then I'll have you raise your eyebrows for me. Smile. Puff your cheeks. Good. Alright, so cranial nerve 7 is intact. I'm going to have you read off all these on the bottom line for me here.
A, B, C, D, E, F, G.
So his visual acuity is intact, and it's 20/20. So I'm going to move on to examining his eyes here. So have you look straight ahead for me. Good. Good. Now follow the top part of my pen light here. Accommodation. Good. And then we're also going to test your peripherals here, test for nystagmus. Just follow it all the way out. Good. Good. Alright, so cranial nerve 2, 3, 4, and 6 are all within normal limits. So we're going to check the external ear for any lesions. None here. None here. Alright. I'm going to have you cover your right ear and say out loud what I whisper into you. Chocolate.
Chocolate.
Now switch ears. Raspberries.
Raspberries.
Alright. So cranial nerve 8 is going to be intact. So now I'm going to ask you to identify the scent that is on this cotton ball here.
Caramel.
So cranial nerve 1 is going to be intact. So I'm going to palpate the sinuses here. Any pain here?
No. No.
So no pain upon palpation of the frontal and maxillary sinuses. So now I'm going to have you plug one of your noses. Breathe in. Any discomfort or anything?
No.
Switch. Any problems?
No.
So we're going to also inspect inside the nose here, check for any sort of deviated septum, and then go in the mouth. And say ah.
Ah.
So cranial nerve 9 and 10 are intact, and his teeth, tongue, and buccal mucosa are all within normal limits. So now I'm going to have you clench your jaw here. Good. And then stick out your tongue. Now cranial nerve 5 and 12 are intact and within normal limits. So now I'm going to just touch your neck here. His trachea is midline with no deviation in the thyroid. I'm also going to palpate for the carotids here one at a time. So his carotids are 2+ and equal. Now we're also going to feel for the lymph nodes here. So turn your head to the side here. So preauricular, postauricular, occipital, jugulo-digastric, submandibular, submental, down the cervical chain to the supraclavicular. And all of the lymph nodes are non-palpable and within normal limits. So I'm going to have you turn this way from me, and we're going to listen to your back for your lung sounds. So we're going to be doing the modified Z pattern. So we're going to start up here. When you feel me touch the belt to your diaphragm to your back, just go ahead and take a deep breath in. Good. 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 All right. So I'm going to have you lay down for me on your back. Move this over here. Put it like that. So now we're going to listen on the front. We're going to be doing the modified Z still. So when you feel this, touch your chest, take a deep breath in. Good. 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 So now we're going to move on to heart sounds. So we're going to go feel here, aortic, pulmonic, Erb's point, tricuspid. We're going to palpate the mitral for 30 seconds here, or auscultate. So the heart at a regular rate and rhythm, and at this point we're also going to palpate or auscultate for the aortic valve down here, or aortic artery. Aorta, sorry. Good, and then renal. Good. Good. Alright, now I'm going to have you turn your head over to the right here. So there's no JVD noted. We're also going to take your finger here. Capillary refill is less than 3 seconds, which is within normal limits, and there's no JVD present. We're also going to auscultate for any carotid bruits here. Nope, those are clear and equal. So now we're going to move on to abdominal sounds. So we're going to listen in all 4 quadrants. We're going to start in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. We have positive vowel sounds in all 4 quadrants of the abdomen. So now we're going to move on to percussion here. Those are all within normal limits. Now we're going to do light palpation. Good. And now we're going to do deeper palpation. All right. So there's no abnormal masses or anything felt, and everything is within normal limits. So now we can go ahead and have you sit up here for us. So patient is on room air right now with no difficulty breathing. His lung sounds are all clear. There's positive bowel sounds heard in each section. Sorry, I'm actually going to have you lay down one more time. Okay. So I'm going to have you bring your leg up here. Any pain? No. Other leg up. Any pain? No. I'm going to have you bend your knee right here for me. We're going to bring it out and then in. Any pain there?
No.
Bring this one down. Lift up this one up. Out, then in. Any pain there? No? Okay. So now I'm going to have your foot follow my hand, so bring it up, out, across, middle, down. Good. Bring it up, out, across, middle, down. Good. Now I'm going to have you push down on my feet, or hands, pull up on my hands. Good. And then now I'm going to have you lift your leg up and touch my hand here. Good. And another one. Good. So range of motion is all going to be within normal limits. So now I'm going to have you kick your legs over the side of the bed here and sit up. I'm going to have you kick your legs for me. Good. All right, now I'm going to have you with your toes, point your toes inward, like this, outward, and point your toes down. Now other leg, inward, outward, point your toes down. Good. So I'm going to have you move this up. Now we're going to have you follow me, go neck to ear, forward, backwards, and then side, and then other side. All right, good. So now I'm going to have you raise your shoulders against this resistance here. Good. So now cranial nerve 11 is within normal limits. So now I'm going to have you flex and extend your arms here. Good. Now just your wrists. Good. Now your hands. Good. All right, so all that range of motion is going to be within normal limits. Now I'm going to have you stand up real quick. I'm going to have you put your hands behind your back like this. Now your hands behind your head like this. Good. All right, so those are all within normal limits. So I'm going to have you put your palms together in front of you. Make a big circle, go up top. Good. All right, so now I'm going to have you step over here to the side. I'm going to have you take 5 steps forward, walking normally. Gait is within normal limits and steady. Now I'm going to have you walk heel to toe back to me. Good. It's all within normal limits. Now I'm going to have you stand right here. I'm going to have you close your eyes and just stand up straight. Good. No swaying, so the Romberg test was within normal limits. Now I'm going to have you follow what I do with my fingers. So just do fingers to your thumb. Good. All right. So now we're gonna put your hands down on your thighs here. You're gonna start like this and then alternate, slowly getting faster. Good. So now I'm gonna have you sit back down. I'm gonna have you, so this is gonna be dull, and this is gonna be sharp. So I'm gonna have you close your eyes and identify a few, say whether it's dull or sharp.
Sharp. Dull. Sharp. Dull. Sharp.
Good. Now I'm gonna have you close your eyes and stick your hand out, and tell me what this is that I'm placing in your hand.
It's a Q-tip.
Q-tip. Good. All right. Now I'm going to have you keep that hand open. I'm going to write a number in your hand. You tell me what number it is.
1.
Good. Now other hand.
1.
Good. All right. So I'm going to have you close your eyes. I'm going to touch you in 2 spots, and I want you to be specific and identify those spots.
Right shoulder, left knee.
Good. All right. So now we're going to test the reflexes. You can open your eyes now. So I'm going to test the biceps reflex first. Here. Good. The other side. Good. Now we're going to do the triceps. So I'll have you turn your arm like this. Let it hang loose. I'll put it here. Good. The other arm. Good. We're going to move down to the patellar reflexes. Feel it here. Good. Here. Sorry, that was a little hard.
Yeah.
Alright, and then we're going to do the Achilles after too. So we're going to go back here. Hit it on there. Switch to the other leg. Hit it there. Alright. So now we've done all the reflexes. We're going to go back through and just double check all the pulse points that on him. So we're going to do the brachial pulses here. We're going to be 2 plus and equal. The radials are going to be 2 plus and equal. We're going to do posterior tibials. They're going to be 2 plus and equal. And dorsalis pedis is also going to be 2 plus and equal. So that would conclude our exam. Is there anything else that I can do for you today? No. We're going to make sure that the call light is going to be within reach for our patient. We're going to thank our patient and perform our hand hygiene on our way out the door. So in our SBAR, we are going to say, today we had a 24-year-old white male come in for an exam. He was ANO times 4. He was well-dressed and well-groomed. His skin was consistent with his ethnicity. There were no scars, tattoos, or lesions present. He was a 23 out of 23 on the Braden scale. His temperature was 98.8. He wasn't in any pain. He had a pulse of 74 beats per minute. His respirations were at 16. His oxygen saturation was 98% on room air. His blood pressure was 122/80. His lung sounds were clear and equal in all fields. His breathing was easy and unlabored. His heart had a regular rate and rhythm with no JVD and a CAT refill of less than 3 seconds. He had positive bowel sounds in all 4 quadrants. His musculoskeletal system was even and symmetric with free range of motion. All 12 cranial nerves were intact, and the patient was comfortable and neurologically intact. And that concludes our assessment.